My name is Dr. Eric. I'm going to be going through some x-rays out here, but I won't be going through you guys' x-rays, so you can relax. I won't put your stuff up here in front of anybody. We'll take you in the back individually in a few minutes and go through your x-rays with you in private. What we're going to do here is make sure you understand exactly what you're looking at when you see the x-rays, because the more you understand about your problem, the faster you get better. Some of you may have insurance questions, financial questions. We'll go through those with you in private as well. I've been here in this office for about 12 years now. Over those 12 years, we've built one of the largest natural health care clinics in the U.S. And probably best known for this book here. It's called Cruise Ship or Nursing Home. I always ask my patients, where do you want to end up? And what does everybody say? On the cruise ship. The problem is, where do most people that you know actually end up? In the nursing home. So our job is to move you here in this direction. And we've sold over 100,000 copies of this book, and you'll see people in here that have gotten off of their medication and got well and seen 20 medications go in that trash can, and incurable illnesses get better. And what we firmly believe in here is that you're not a victim of your genetics or bad luck. If anything, you're a victim of bad choices, but you're in control of your choices, okay? And we're going to teach you how to make the right ones. But what I want to go through here tonight from the book is just how we're able to get you well. So it's going to include your x-rays. We're going to go through the x-rays in a second. But the first thing I want to start with is just mindset. The mindset of the most important asset that you have. So walking in here, what's the most important thing that you have in your life asset-wise? What do you guys think? Yeah, your health. And I had somebody the other day say, oh, well, you want me to say my health. And I'm like, I don't want you to say your health. You should say your health. Steve Jobs, had $10 billion, and I couldn't save him when he got cancer, And unfortunately, everybody said we pay lip service and say, oh, yeah, my health is the most important thing. But then all of a sudden, when you lose your health, that's when you really realize it. So if the health is the most important thing that you have, somebody tell me what health is. If that's the most important asset. What's health?
Your body functioning the way that it's supposed to.
Good answer. Most people, if I went over to King Supers right now and said, hey, are you healthy? People would say yes or no based on what?
Their weight.
Their weight, how they feel, right? Their energy level, all of those things. They don't say anything about function, they say how they feel. And the problem with basing your health on how you feel, which is what most people do, is you miss the top 3 causes of death in the United States if you focus on how you feel. The third leading cause of death in the United States is heart disease. Heart disease kills about 550,000 people per year in the United States. The other really big one, what's the other big one you have to worry about?
Cancer.
Yeah, cancer, right? Oops, almost got me with the door there.
Sorry.
You get front and center. So cancer kills about 700,000 people a year in the U.S. And the thing about heart disease and cancer is, how do heart disease and cancer feel while they're developing in your body? Yeah, you don't feel anything at all, right? So these things they're 95% preventable based on your lifestyle, right? It's only 5% genetic. So everybody's not waking up going, oh, I'm just going to live a lifestyle that's causing heart disease and cancer today. These are blind spots. People don't even know what you're doing is causing heart disease and cancer. So my job is to point out those blind spots. And the biggest blind spot really is with the nervous system. But if these are 2 and 3, anybody know what number 1 is? Leading cause of death and injury in the U.S. Anybody heard me talk about this before? Or anyone else? Number 1 cause of death. It's not heart disease, it's not cancer.
Prescription.
There's a book called Death by Medicine, okay, and it's written by Gary Null. It was written by 2 medical doctors and 3 PhDs. And what they say in this book is the number 1 cause of death and injury in the United States is what's called iatrogenic death. And iatrogenic means, it's Latin for doctor-induced, which means something the doctor did killed you, not the disease itself. So you went to the doctor, you weren't supposed to die of anything, they give you some type of treatment, and you died from the treatment, not the disease. And part of it is prescription drugs. Over 106,000 people a year die from correctly prescribed medication, and then another 300,000 people from incorrectly prescribed medication. So when you add all of these things up, just from going to the doctor, normal doctor visits, that actually kills, they say 780,000 people a year die from going to the doctor. So you want to avoid heart disease and cancer, but what should you really be avoiding more than anything else? Going to the doctor. And the thing is, guys, these are preventable. So you live your life so that you don't end up in the doctor's office. You don't end up staring chemotherapy in the face. And I don't bash doctors because it's not the doctor's fault. It's not like they're evil and trying to kill you or something. The doctors who went to school for 12 years because they love you and want to take care of you, they're in a system that's broken. I will say that. But the thing with the doctors is, like, my grandmother was one of these statistics. She got a drug. It caused her liver to shut down, and she died from a medication. It's on her death certificate. But I'm not mad at the doctor, because ultimately, whose choice was it to take the medication? It was my grandma, right? I had somebody the other day, they did a surgery, and one of a new patient said it got messed up from the surgery. But who okayed the surgery? You do. We try to give up responsibility for our health. You can't give up responsibility for your health. You're responsible for that, But the problem is our philosophy when it comes to health or being well, because we don't have a healthcare system, we have a sick care system. Does that make sense?
Yep.
You have to be sick. They don't do anything if you're healthy. They don't do anything to keep you healthy or make you healthy. They just try to make you less sick. And the issue is, if you go to the doctor, you wait till you're sick, you go to the doctor, what does the doctor do for you? One of these, right? And if one of these don't work, what do they do then? Yeah, well, a different one, yeah, another one of those. And if that doesn't work,
They give you another one.
then they'll do that or surgery, right? That's kind of the last resort. Now, here's the issue with that kind of type of mentality. This is a blood pressure medication. So let's say you have a 135 over 90 blood pressure. And I say, you know what, just take this medication the rest of your life and you'll be better. Is she going to be better or worse off than she was before? Why would you say worse? Because most people, again, would say better. Why would you say worse?
Because you're not addressing the cause.
You're not getting to the cause, right? It's a Band-Aid. It's like taking a piece of duct tape and putting it over your oil light when the oil light comes on. Your car's still blowing up, but now you don't know anymore. So the biggest problem is now you think you're fine. Plus you have all these side effects and everything. And all we've done is made you comfortable on the way to the nursing home. That's all we've done. Taking those medications. Now, thank God there's drugs that are meant to save your life, and thank God we have those drugs, but these drugs in this trash can are not for emergencies. These are drugs that these people would have been on the rest of their life had they not changed their lifestyle. And I've seen people under the sun get off of every one of these medications just by changing your lifestyle and taking control of that thing. But what they say in the book, it's a really interesting book, what they say is the reason that we are so sick as a country, the reason we rank 37th in the world is because we've given up responsibility for our health. So the responsibility is no longer ours, we've given it up to somebody else. And they say the two main culprits for that are, number one is the pharmaceutical companies who really run our healthcare system, including the FDA, and it's all pharmaceutical company CEOs that are on the board of the FDA, guys. So they're actually running the system. We're the only country in the world, we're one of two countries in the world that allows direct-to-consumer advertising. When you're reading the magazines and you see what's this drug and you see it on TV at the Super Bowl and all of those things, one of two countries in the world that allows that. And so in 1986, the spending was about $2 million for the pharmaceutical companies on those ads. Now it's $4 billion because they're making so much stinking money. It's crazy. But the other one they said, which is actually more insidious than just the drug companies, is they say it's the insurance system that's really the cause of our problem. Because everybody knows, like, the insurance, I think everybody gets this. Like, if you have great major medical insurance, right, they cover everything, low deductible, they cover everything. I have, like, terrible insurance. I have, like, Kaiser or some type of, HMO. We both go to the doctor. Are we going to get the same type of treatment? Absolutely. Everybody knows that. We're not getting the same treatment because I just read a book by Ray Strand. He's an MD. And he said the first time he started working at a hospital, they were taught to do what's called a wallet autopsy. And if they open up your wallet, and if it was positive, you got all the testing that you needed. And if it was negative, you didn't get any of the testing. So it's not about you and your health. It's about playing that game, And what we do in here is we don't play games. This is about your health and about you getting better and getting that power back. But the biggest thing I see with insurance is people always ask me, like, does my insurance company, are you on my Kaiser plan or on my HMO or whatever? And I'm not on any of those. Here's why. For any doctor to bill your insurance for anything, me or anybody else, it has to be what's called medically necessary care. You guys ever heard of that before? Medically necessary means, here's the definition of it. This is from the Medicare code. And it says, this is the definition. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. I'll read that again. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary. That's the exact opposite of our mission statement in here. So that's why I'm not on those HMOs, is because they don't allow you to get people better. And when you say, like, does my insurance cover it, what you're really asking is my insurance responsible for my health? And the answer to that is what? No. Who's responsible? This is the part nobody likes. Who's financially responsible? I didn't get so many yeses from that one. You are, right? And I am, for my family. I have health insurance, but my goal is to never use it. It's there for an emergency because I don't want to have to pay $10,000 if my daughter breaks her arm or something. But we don't use our health care because it's not health care, it's sick care, right? So we're responsible for it. Now, when it comes to health, you gave a great answer when it comes to what health actually is. What did you say it was again?
How well your body functions.
Health equals 100% function, okay? Function is what controls health. And that is the definition of health right there. If you have 100% function, you get a heart attack tomorrow. Nope. You have 100% function, you get diagnosed with cancer tomorrow. Nope. You get cancer because you have less than 100% function. You get heart disease because you have less than 100% function. Now the thing is, no matter what you came in here with, The one thing we looked at is your brain and your spinal cord, because what controls every bit of the function in your body? What part of your body? Your brain, right? Your brain and your spinal cord controls everything. So if you're having heart problems, I don't just care about what's wrong with the heart. I want to know what's controlling the heart, or what's controlling the stomach, or what's causing these issues. So when I look at you, looking at your spine here, your brain and your spinal cord, they control everything that happens in your whole body. So for your heart to be beating right now, or for your food to be digesting right now, information has to go from your brain, down your spinal cord, out the body through those nerves. And there's a principle that we work with in here that goes like this. Your body needs no help to heal you. It just needs no interference. I said more than you probably heard there. Your body needs no help to heal you. It just needs no interference. In other words, we just need to stop getting in the way. Your body needs no help, just no interference. If your body can build you a new stomach lining every 12 hours, or a new lung lining every 24 hours, or 50,000 new cells every 3 seconds, think about that. Don't you think it could fix your back pain, or your stomach problems, or whatever you came in here with? The answer is, of course it can, but why is it not healing? Something's what? Interfering. Something's in the way. And as a chiropractor, that's what we look for. When we look at the 5 essentials, could your diet be interfering? Of course, and we work with that. Could your toxicity levels be interfering? Of course. But the easiest way I can damage your body is by damaging what? Your spine. That's it. Nothing else matters when it comes to that. So when I look at your spine, what you have to be to have that function at 100%, from the front, you have to be straight up and down. I think most people know that, right? Straight up and down like this. From the side, though, you have to have curves. You have to have a curve in your neck, curve in the mid-back, and then a curve in the low back. And as long as you have those normal curvatures, all the messages are able to get where they're supposed to go. Now, and again, let's just talk laws for a second. If I separate your head from your body, what happens to you? How many times out of 100? 100, right? That's a law. That's not a theory. Okay, nothing I'm talking about is a theory. So what happens if I pinch the nerves that are going to your heart? Is your heart going to be getting healthier or getting sicker? It's going to be getting sicker, again, 100% of the time. So when I look at your spine from the side, you have to have these normal curvatures so all the messages get where they're supposed to go. And the one that's most important is this one from the side. It's called your lateral cervical. It's called your arc of life. So this is the brain. That's the spinal cord right there. This is a cross section. Like, imagine if I cut like this, and you're looking down. Does that make sense to you guys? Like you're looking down to the top of the spinal cord. See how nice and open the spinal cord is there? You guys see that's like a hose? This is a cross section here through this neck, right? So the neck is now straight. What happened to the spinal cord? Can you see it? Yeah, it's compressed, right? So it's like someone stepping on the hose there. So if the person on the left gets the flu and the person on the right gets the flu, who heals faster? Who gets heart disease first? Who gets cancer first? Right? And so because that's, again, less than 100% function. So what happens is, only 6% of the nerves in your body feel pain. This is what's scary about this. Some of you guys are in pain, some of you are having organ issues, but the pain doesn't matter, because if you lose that curve, and that can be from, like sitting on a computer all day long, it can be from car accidents, any of those things, that's what causes this poor posture over time, slips and falls, and you lose that curvature. What it does is it pinches the nerves and pinches the spinal cord. It's called pathological tension there. Now, if those nerves go to your thyroid, there's no pain receptors in your thyroid. They don't feel pain. What happens is you don't feel anything for a long time, and all of a sudden a crisis hits, and then maybe you can't lose weight, you don't sleep so well at night, your thyroid's not working, you go to the doctor, and they tell you what? Thyroid disease, right? And why do they tell you have thyroid disease? Family history, you're getting old, something like that, and you need drugs the rest of your life, and maybe you actually buy into that lie that, yeah, my body's broken, I need to be on drugs the rest of my life. But in the back of your head, you're going, oh, if I cut myself shaving today, that would heal, right? I'm still building 50,000 new cells every second. Like, why is this not healing? But maybe you ignore that, and you just take the drugs the rest of your life, and you get nothing but what? Worse, because it's more medication, and on the way, all your money goes where? Out the window, because you're spending all your money on sick care, on being sick. So, in order to stop that from happening, what we do is we get to the cause of the problem, not just cover it up with some type of medication. So, if you have this loss of the curve, this is what's called phase 1 degeneration. See how stretched the spinal cord is there? You guys see that? It's dented in right there. That person's already building disease in phase 1. There's just normal space between the discs still. So that just tells me that it's been there 10 years or less. 10 to 15 years is what's called phase 2, because now you're getting damage to the disc. You guys ever heard of like degenerative disc disease? And it drives me crazy because it's not a disease. It's just an effect. Like if I'm walking on the side of my foot all day long like this, what's going to happen after a couple years? Is it going to be swollen? Think I'm going to get bone spurs in my foot after doing that? Yeah. Would you call that walking on the side of your foot disease? But the only reason your spine ever degenerates is because you lose the normal alignment in the spine. So it's a natural effect of that loss of the curve. But when you're having disc damage in there, think about this. If you're getting a bone spur, if you see any bone spurring on the x-ray or disc degeneration, those bones are hard and meant to outlast you, right? What do you think is happening to the spinal cord if the bones are breaking down? That thing is toast. You guys get that? That's been there for 15 years worth of damage and disease. And then this is phase 3. The only reason I don't see very many phase 3s, what do you think that would be? Yeah, those people are not walking around. Yeah, no, they are. They're dead, or they're on 50 medications in a nursing home, or something has killed them before that. Because you see how withered the spinal cord looks right there? Now, if you're in phase 3, there's nothing anybody can do to correct that. But if you're in phase 1 or phase 2, thank God, you can still correct that. And that's where most people are when they come in here. So when I look at your x-ray in a minute, when we show you that x-ray, first thing you have to see is this 45-degree curve like this, okay? Second thing you have to see is that this top bone needs to be pointed up instead of pointed down like this. Everybody, put your finger there, like right behind your ear. That's your brainstem. Okay, you can put your finger down, but that's your brainstem right there. Your brainstem coordinates everything in your body. So for you to eat breakfast this morning and like 20 organs had to come together and with like in a symphony to digest that happened with the coordination of the brainstem. This is also where your body makes serotonin. What do you think of when I say serotonin? Anybody know? Sleep or depression, one of those two things. So if this bone gets shoved out of position like this because you're on a computer all day long, or you had an accident, or your posture's been like this, your serotonin levels go down, and what do you have depression, anxiety, and they put you on depression medication or some type of Ambien to go to sleep or something like that. And how much of this is it going to take to fix that? This is never going to fix that, and you're going to be on that the rest of your life. So that's the second thing you have to see is this top bone pointed up. And then the last thing is the head needs to be right up on top of the shoulders. Okay, instead of out like this. Put your head forward like that. Take a big breath in after you do that. Now put your head back normal. Take a big breath. You see how you can't breathe with your head forward like that? That's, again, direct pressure on the nerves to the heart and the lungs when your head's forward. When you see people shuffling around like this after a while, what are they always hooked up to? Oxygen, because it's shutting down the nerves of the heart and lungs. So she came in to see me, 80 years old, 0 medication, still plays golf 3 times a week, does everything that she wants to do, perfect curve in her neck, and she's 80. And so if anybody's ever told you that degeneration is normal, you've been lied to. It's not normal. It's common, but it's not normal. So she came in here at 80, everything's great. She comes in, this is Robin, 39 years old. What do you see on that one on the right? First of all, curve or no curve? See where it is? It's almost completely straight. See how far her head is forward too? What do you think she's been doing for the last 15 years as a job? She sits on a computer all day. And she's been doing that forever. She also, a couple car accidents that she was in. She came in first time and I said, when was your last car accident? She's like, I've never had one. And I said, okay, if you're 40, let's pretend you have had one. When was your last car? When would that have been? And she's like, oh yeah, I had one like 12 years ago. What happened in that? Somebody hit me going 50 miles an hour, but she's like, I didn't think you needed to know about that one. Well, that's the one I'm more worried about because it's been there for 11 years worth of damage. So she comes in here to see me with this problem. What kind of problems do you think she's having, first of all? You don't have to be a doctor to figure this out. You're damaging this bone up here, that brainstem. Again, what kind of problems do you think she'll have? She's on 2 antidepressants. She's fatigued all the time, and her digestion's a mess. She has IBS, so she can't go anywhere without having to have a toilet nearby. The spinal cord's running through there, so it's completely choking off the spinal cord there. What else do you think that would be affecting? Everything else. These nerves in the base of the neck down here. See how these bones are straight on the edge, and then that one slopes, and that one really slopes. Can you guys see that? That's phase 2 degeneration right there. She's already got this bone spur right there. So again, what's happening to these nerves back here? They're being crushed. And these nerves go down to the hand. So she's got this numbness and tingling in her hand. They call that carpal tunnel. So the doctors went and cut the carpal tunnel. That didn't fix it. Flip the other side, cut the other one. That didn't fix it. Because where was the problem coming from? It was here. But how many people do you think actually took an x-ray of her neck? No one. The hand surgeon did surgery on the hand. That's what they do. So she came in here, and this is what's crazy. She's on like 7 medications, and guess where she was going before she came to see me? For like 15 years, she told me. To a chiropractor. For 15 years. And that's what I looked at. I'm like, the heck did your x-ray look like 15 years ago? Guess what she said? I never had one. Yeah, I never had an x-ray. They had a low back x-ray because I went in for low back pain, never took one on my neck. I'm like, well, you went like once. She's like, no, I went for 15 years and got nothing but worse. So it was an HMO. She would go, whatever her 15 times a year was, pay her $35 copay, get her neck popped. And there's 2 types of chiropractors. There's what's called relief care, and then there's corrective care. 95% of my profession, including everybody you drove past to get here, is what's called a relief care chiropractor, which means, again, pop your neck, hope it feels better, come back and see me when your neck hurts again or your back hurts again. And I know the guy she went to see is a nice guy. And he's not a bad guy at all, but he does relief care chiropractic, which is like expensive aspirin. What we do is called corrective care. And the reason we do that is, raise your hand if you would like me to get rid of your headaches, but leave your spinal cord rotting and degenerating. Anybody? Nobody says yes to that, yeah. And that's what she had been doing for 15 years, and she didn't know any better. So what we do is actually called corrective care, which is taking something that looks like this and correcting it. So she does very specific adjustments, very specific rehab. But the first thing we did was we adjusted her and then took a head-weighted x-ray. We did that on several of you guys. This is her x-ray the next day that she's in with the head weight on. What do you see there already after one adjustment?
Curve.
You guys see that already? She's already got the curve coming back. I remember I called her that night. I'm like, hey, how are you doing after the adjustment? And she's like, and I hear like this wind. I'm like, what the heck is that? She's like, that's my left nostril. I haven't been able to breathe out of my left nostril in like 15 years. You know, she's just thrilled because her sinuses are opening up. And so she does, again, very specific adjustments. You see every time you come in, people scan their card back there, and then the x-rays pop up for me at the table. So everybody's getting specific adjustments based on what's wrong with them. And if it's been that way for 15 years, you guys see how it's not going to get corrected overnight? Again, there's just no way to fix that in one visit. So she comes in, like braces for your teeth. They take a year to 5 years, depending on how crooked your teeth are. It takes about 9 months to correct something like that in a phase 2. So she's doing specific adjusting, specific rehab at home, about 10 minutes of home exercises, which are non-negotiable. They have to be done, or else we don't correct the ligaments and fix this. And we take an x-ray every 90 days to make sure things are corrected. So after that first 3 months, things are moving back in the right direction. She's off of the Cymbalta and the Paxil that she was on. She's starting to sleep like 6 hours a night instead of 2 hours a night. Drop her down to once a week, took another x-ray at 6 months. Again, things are moving in the right direction. And then this is her x-ray after 9 months. What do you see there now with no head weight on? You guys see that? Curve. She goes from a 0-degree curve to 28. Forward head posture goes from 45 back to 21. Guess what happened to the numbness and tingling in her hand? Gone. She can play golf again, which was her main thing that she wanted to do. All 6 medications in that trash can. She's no longer a slave to those medications. And her whole family's different. Her daughter had asthma. Asthma's completely gone. And how do you think she wants to keep it looking that way? The rest of her life, because she still does this all day long. You know, she still does that. So she comes to see me a couple times a month to maintain where it's at. She does some home exercises to make sure she doesn't end up hunched over like that again. But that's the easy part. And here's the thing about that. So depression went away, blood pressure problem, pain here, horrible digestive problem went away. But who healed her? It was not me.
Her body.
Yeah, her body healed her. The power God put in her body is what healed her. I did not heal her. All we did was remove that interference. And like I always say, where does the best doctor in the world live? Right inside you. Right? And what's it worth to have that functioning at 100%? It's priceless. You know, somebody told me that's priceless. I'm like, that's kind of a cop-out because everybody said, well, priceless. I'll put a dollar value on it. If you retire right now, if you want to retire, they say Fidelity Investments says you need $250,000 liquid to be sick for the rest of your life. That's just for your medical expenses for the rest of your life if you retire today. $250,000. So it's worth $250,000 because guess where she's not anymore? She doesn't go to the doctor anymore. She doesn't have all these co-pays anymore. She's not heading towards the nursing home anymore. Her whole life's completely changed, and that's a pretty good example of a phase 2 neck. I want to show you a low back too because I took this on several of you guys. This is one while you're seated, and from the front, it's from here to here, seated in the low back. These are the hips. And the spine has to be straight like this. And you see how his is curved to the side? You guys know what that's called when you curve like that?
Scoliosis.
It's called scoliosis, yeah. So she's got scoliosis, or he's got scoliosis, and it's completely choking off these nerves right here, and those are the nerves that go down into the leg. So he's got sciatic pain going down in his leg. The doctor wants to do surgery. But then those same nerves also go to the colon. And so if you're damaging the nerves of the colon, what kind of problems do you think you're going to have?
You could have cancer.
Yeah, well, he had constipation first. He was going to the bathroom like once a week, and what did that lead to? Colon cancer. I mean, if you have damage to those nerves down there, there's no ifs, ands, or buts. You're building disease in those organs. Whether you feel it or not doesn't matter at all. One of my best friends got diagnosed with stage 4 multiple myeloma brain cancer 2 years ago. And guess how he felt 2 weeks before he got the diagnosis? Fine, and he was given a death sentence, 6 weeks to live. You know, so it doesn't matter how you feel. I mean, my friend wasn't healthy, even though he felt healthy. He was dying, you know? So he comes in here, and we started working with him. He got referred in by another patient, and thank God, because he was about to go do this injections in his back and then surgery, and thank God he got in here. And we started working with him, and this is his x-ray after 6 months of working on it. What do you see on that one on the right now? You see that? Straight up and down. Scoliosis is gone. the pain shooting down in his leg, gone. His calf's not falling asleep anymore at night. He waited about 2 months and went back to the oncologist, and they did another scan, and guess what they said about the cancer? Gone. You must have been misdiagnosed. You don't have colon cancer anymore. And I see that happen with people all the time. My friend who was diagnosed with stage 4 cancer 2 years ago, guess where he is? Still alive, cancer-free. He was given a less than 1% chance of living. But what healed him? Power inside him is what healed him. And he did B5 essentials, did the things he needed to do. But when do you think that started? It's a 32-year-old guy. When do you think that thing started?
Not when he was riding
Not when he's
bicycle.
32. Yeah. So that's a 20-month-old little girl.
Yeah.
You guys see that already? Massive scoliosis there. She was a vacuum extraction delivery. You guys ever heard of that where they put this thing on the head and they pull them out like this?
Had one.
Yeah. My daughter was a vacuum extraction. And when she got cranked out of the birth canal like this, I've seen this up close. And so through 3 full contractions and pushing my wife, she's pulled out like this, and that top bone got just completely wrenched over here like that. Where do those nerves go? First place they go is where? Right to the lungs. So my daughter's not breathing. So she's turning blue. And that's my firstborn. I'm freaking out. and the nurses, I didn't freak out until the nurses gave her to my wife and ran to get a crash cart because she wouldn't breathe. They're rubbing her and everything. And I picked her up, and this top bone was rotated out of position like this. And I picked her up, and I didn't ask her if she had insurance or where her neck pain was. All we do is just a little bit of pressure, and you hear it. And right away, starts to breathe, starts to cry. And the nurse came back in. She's like, "What'd you do?" I said, "I adjusted her." And she's like, and this happens all the time. Like we see this happen all the time. She would have been in NICU, or God knows what would have happened to her. But what would have happened to her is what happened to this little girl. The same nerves that go to the lungs go to the inner ear. So she's got what? Massive ear infections. And so she's been on antibiotics the time she's born. She's literally at 2 years old. She's like this big instead of how tall she's supposed to be. And we started working with her and adjusting her. And I love taking care of kids because they heal so much faster than adults. I think a lot of it because they don't have the stuff between the ears that we have. They're like, yeah, I'll get better, sure. So she comes in and we started working with her. This is her after 2 months there. So again, what do you see there? Straight up and down. Ear infection's gone. Mom feels like she got her child back for the first time since she was born. Completely different little girl now. No ear infections. Now, the number 1 risk factor for your daughter getting breast cancer, if you have a daughter, you know what that number 1 risk factor is? Number of times they've taken antibiotics. That's according to the Journal of American Medical Association. And she's been on it since she's born. So she gets breast cancer when she's 34 years old. Everybody goes, I can't believe she got breast cancer. Well, she's been on antibiotics since the time she was born, So that's how important this is and how that nerve function is. But that's the reason we check kids, is because of that. And we check families, and that's something I'm non-negotiable on. I had a little girl that moved away from here. I saw her mom. This is right when I opened. This is about 11 years ago. I saw her mom. Mom had scoliosis, and I said, hey, we need to get your daughter checked. Her daughter was like 6 at the time. And she said, why would you check my daughter? I mean, I'm the one with the pain, just cracked my back, and my husband don't want to get my daughter checked. And which means I communicated poorly to her, apparently, but I didn't push it. I was like, okay, well, yeah, we'll take care of you. And what happened is I saw him for about 6 months, and then they moved. So they moved to Florida, and they came back here about 3 years ago. And I remember looking at the name, I went, man, I still remember that name. And I went in, the daughter's 14 now. So I went into the room, and her mom has her shirt up in the back, and she has these 2 scars from here down to here where they went in and did scoliosis surgery, and the rods broke, so they had to go in there and rip the rods out and pack it with bone chips. And now at 14 years old, she's addicted to OxyContin because she hurts so bad. And her mom looked at me and said, why didn't you tell me it was this important, when she was 6? And I will never let that happen again. I would rather not be a chiropractor than have kids walking around in here without me giving the parents a chance to do something about it. So we're going to take you in the back now and look at those x-rays. The only thing here, the reason I showed you this first x-ray, and this is pretty typical of a lot of what we see and a lot of what you guys have, when you have this x-ray, when you see your x-ray in a minute, you have the same 2 choices she had. So there's only 2 choices. You can fix it or let it get what? Worse. You guys understand there's no option 3, door number 3. There's fix it or it gets worse, and it gets worse when? Every single second. 50,000 cells per 3 seconds are getting worse than they were 3 seconds ago. So she came in here, and she's like, yeah, of course I'm going to fix it. So fixing it looks like this, and I told her she got her whole life back again. Off of 7 different drugs, not depressed anymore, can go on vacation with her husband and do the things that she wants to do, going to end up on the cruise ship. This is not fixing it. You guys know what those are? Those are, yeah, those are rods. Yeah, so he's got 3 rods in his neck like this now. and 12 screws in his neck. How healthy do you think he is now with his neck like that? He's miserable. He like the first time I met him, I went and I said, "Hey, how you doing?" He's like, "How much to cut my hands off?" Excuse me? He's like, "How much to cut my hands off? I would pay you $1 million to cut my hands off. They hurt so bad." That's why he came in, because his hands were killing him. And why are his hands killing him? Those nerves are they're metal on top of them, you know. So where else do those nerves go? They go into the hands, but where else do they go? To the heart and to the lungs. So if you have hand issues, I'm not worried about your hands. I'm worried about your heart and your lungs. He's on a CPAP machine at night. He's on oxygen during the day. He's had open heart surgery 2 or 3 times now, and the guy's literally dying. You know, same thing. OxyContin addict, drinks himself to sleep every night. And I asked him, I said, "Did you know about this problem, Pete, before they did the surgery? Like, what happened? You have a car accident?" He's like, "No, I went to my wife's chiropractor like 5 years ago. He took an x-ray, and he told me I had phase 2 degeneration like this, and he said, if you don't correct this, you're going to have surgery, or you're going to die of a heart attack, one of those two." And Pete's a guy, so he said, "That's not going to happen to me, right? That's not going to happen to me." So he went and got 14 other opinions until he got the one he wanted, which was, put a cortisone shot in there, everything will be okay. So they put the cortisone shot. Did the pain go away? Yeah, because that's what cortisone shots do. But did the problem go away? No, it got worse. It continued to get worse and worse until finally the guy who did the cortisone shot fused his spine together for $100,000. And so what he told the chiropractor at the time, when I asked him, I'm like, "Why didn't you do something?" He's like, "Same 2 excuses as anybody else. I don't have the time and I don't have the what? Money. I don't have the time and I don't have the money." I'll take those individually. He spends all day long in a nursing home watching TV now, so what does he have a lot of on his hands? Time. And it stinks because he's a good guy, and I can't help him. So now his wife was getting adjusted and bringing him in while in the wheelchair, and he'd watch her get adjusted and leave, and the same problem that he came in with. So that's just maturity. You know, it's like, put the time in, because did he want to spend the time? No. But did he have the time? Better believe he had the time. You know, he might have had to change his schedule around, but absolutely he had the time. But the other one is, I don't have the money. First of all, don't get me started on what your life is worth. You know, I just watched 2 of my really good friends almost die of cancer a couple years ago. Both of them spent upwards of $400,000 and never mentioned it once because they didn't care. All they wanted to do was have their kids have a dad. You know, that's what they cared about. They didn't care about the money. But which one's more expensive? Just financially speaking, this was not covered by insurance. She chose to go off of her insurance and come here. This was covered by insurance. Which one's more expensive? What do you think? It ain't even close. This one, $100,000 surgery, they covered 90%, so he had to pay $10,000 out of pocket. That was surgery. He has about $250 of medication that he pays for every month after Medicare picks up their part of the bill. And he lives in the nursing home now. Have you guys priced one of those recently? I don't have the misfortune of doing that. Average in the United States is $6,500 a month average in the United States. So that's about $80,000 over the course of the year. So he said he spent literally $400,000 trying to get his health back. And who pays for the nursing home when you're there? You do. Medicare doesn't pay for that. You pay for it. And then when you can't pay for it anymore, who pays for it? Your kids. So they've spent all their retirement. She lives in an apartment, and now their kids are, strapped with their medical bills. And the thing about this is, he should have just put the time in and done something. So that's $400,000. This over here, this was, again, not covered by insurance, but what she got was that whole 5 Essentials plan. So what you get as a patient in the office, she got, first thing is maximize mind. So give me the plan first. Here's what you need to do to get well. Here's what you need to eat. Here's how we need to make this work. Here's all of the things that you need to do to address that. 2 is maximize nerve supply. All the adjustments, all the rehab that's included in your care plan. Maximize nutrition. So she was type 2 diabetic when she came in. Taught her how to eat the right things. She's no longer type 2 diabetic. She's lost like 40 pounds. We do a thing called the 20 and 30 weight loss challenge. We do a shop with a doc where we'll actually take you to Sprouts and teach you how to shop, read food labels, how to put the right foods in your house, give you the recipes that you need. Those are all included in your care plan. Maximize oxygen and lean muscle. We have a workshop coming up on how to exercise in 12 minutes 3 times a week rather than 45 minutes on a treadmill every day. And then minimize toxins, getting the toxic top 5 out of your house that's making you sick. But all of that over the course of that 9 months, that was about $3,000. Which one's a better investment? That one or this one? I'm not a financial advisor, but I'm pretty sure that's a better investment. And the thing is, it's not even comparing apples to apples, because he spent $400,000 to be sick and miserable the rest of his life, and she has her life back again. Every one of you guys can afford the care that we have. Every one of you. I got single moms with 4 kids that come in here. Everybody's care plans are different depending on what you need, but every one of you guys can afford it. The only thing that we ask if you're a patient, to qualify to be a patient, there's 3 things that we ask. Number 1 is you have to put the time in to fix it. Does that make sense? Because without putting the time in, I'm stealing your money. If I pop your neck a few times, there's plenty of chiropractors that'll do that. You got to put the time into correcting, which means do your adjustments, do your rehab, the workshops that we do, get to those things, make the lifestyle changes that you need to. Second thing we ask is if you have family, you get them checked. Again, we pay for the x-rays. No one has to start care, but we at least ask you get them checked. And then the last thing is we ask is you get on the mission with us. You tell other people what you know. Because there's so many people, and you'll hear me say this a million times, is people are dying out there. We're 5% of the world's population. We take 70% of the world's drugs. 1 in 4 of our children are taking a medication they're going to take for the rest of their life. 1 in 4. 1 in 3 women right now are taking antidepressants that are in their 30s, 40s, and 50s. We have more heart disease, more cancer, more depression, more diabetes than any other country in the history of the world. People are sick, and they don't know that they have an answer. And what does it cost you to tell them the truth? Nothing. It doesn't cost you to tell them anything. So what we do is we ask you, tell them what you know. We do a thing called Dinner with the Doc, where we buy people dinner. I do about a 20-minute workshop on this, and they get a chance to get checked out. If they don't want to, they just get to have dinner, but it gives them a chance to do something about their health. So next time you're in, we'll ask you who you want to change their life, because you get a chance to be a hero with these people. So we're going to take you in the back and look at those x-rays. I just want to make sure I'm clear. I had a conversation with somebody today. I want to make sure I had this with you guys. She came to an x-ray report, and she called me, and she said, well, what's included in my care plan? And I went through it with her, and I had no problem answering questions. But then she said, well, I see that your book is included in the care plan, because if you're a patient here, you get a copy of the book. So there's a cost for the book in the care plan. And she's like, I don't want that. And I said, it's in the care plan. I don't know what to tell you. What we want is for you to transform your life. And how you transform your life is all of this information in here. And she's like, well, you're going to make me buy your book. And I said, no, I'm not going to make you buy it. But if you put it that way, yeah. If you're a patient here, yeah, I am. Because I care about your health. And she said, oh, okay, well, I guess that makes sense. But the point there is, she said, well, I don't know if I want to do all that stuff, and that's okay. If she doesn't want to do all that, that's fine. If she just wants to get popped a few times, that's okay. But just to be clear, this is all we do. All I do is life transformation. I don't do quick fix and this. I want you to be well. I feel like you're entrusting your health to me. I want you to end up on that cruise ship doing what you want to do. So those 3 things are really simple. We want you to be well, and we want your family to be well, and we want the people around you to be well. And I don't care if they're here or if they're in Texas. I'll find them somewhere to get help. Okay? So we're going to go back and look at the x-ray. Sandy's going to be in just a second. She's going to put you guys in private rooms, and I'll be